with Insight for Action, and I'm facilitating these meetings. Next slide, please. Quick reminder about meeting logistics. This meeting is being recorded. Closed captioning is available. For Community Review Board members, click the React button, then select raise hand or raise your hand physically if you want to ask a question or share a comment. And thank you for remaining muted until it's your time to speak. Next slide, please. The Community Review Board members will discuss the transaction during these meetings, and members of the public can submit comments about the proposed transaction anytime using any of the options listed here, such as email, submit a comment via the public comment form, or leave a voicemail. All comments received are posted on the OHSU-Legacy transaction page, and I believe this, the email, the form, and the voicemail number will be uploaded to the chat, so you have that freely available. Next slide, please. Only the host and co-host can see chat messages. Community Review Board members, if you're experiencing any technical difficulties, please send a chat message to Laura Neely. Members of the public, if you have a comment or question for the Community Review Board, please submit it via email, voicemail, or online form instead of sending it via chat. And I've noticed that those contact informations have been uploaded to the chat. Next slide, please. Today's goal is to vote on a recommendation for OHA. We'll do brief interjections and remind us of our timeline. We will briefly recap member statements made at the last meeting. We'll then vote, identify next steps, and close and highlight the agenda for the next meeting. As we typically do, we'll take a 5-minute break about halfway through the meeting. Next slide, please. A quick reminder of where we've been and where we are headed. On March 19th, we had a public hearing debrief and been discussing the recommendation framework. On March 24th, we continued discussing the transaction towards developing the recommendation. Last week, on March 31st, we discussed ways to mitigate concerns or strengthen identified opportunities. Today, April 7th, we're going to finalize the recommendation, assuming the Community Review Board is ready. And then on April 16th, the Community Review Board will review and edit a draft recommendation report/memo that OHA will have prepared, and if ready, approves the recommendation. So as a reminder, the next meeting will be April 16th from 2 to 3. Next slide, please. I would appreciate it if the Community Review Board members would turn on their camera. And as we typically do, share your name, where you live, and hey, in the spirit of spring, you might want to share your favorite spring flowers. So just go ahead, raise your hand, and I will call on you for introductions. Wonderful. Teresa.
Hello, everyone. I'm Teresa Goodell, a retired registered nurse, and I live in Aloha, Oregon, and I've got some lovely jonquils out in front of my house.
Thank you, Teresa. Leslie, please.
Good afternoon. I'm Leslie Foran, and I am a community volunteer, and I live in Portland. And I would say lilacs are my favorite.
Those smell nice. Thank you, Leslie. Who would like to go next? Raise your hand, please. Joe, thank you.
I'm Joe Schnabel. I am a community member, and our tulips are just about ready to explode. So those are my favorite ever since I took a little trip over to the Netherlands many years ago.
Beautiful. Thank you, Joe. Latoria, please.
Yes, hello, I'm Latoria. I'm just a volunteer community member. I'm in Portland, and I'm enjoying seeing all the nice spring colors out there. So no specific flower, but I do enjoy seeing them all.
All right. Thank you, Latoria. Okay. Howard, thank you.
I'm Howard Cohen, retired neonatologist physician who lived in Oregon City. And I particularly like the irises driving along I-5 between Oregon City and Salem. And they'll be here soon.
Yes, thank you, Howard. All right, I'm just checking if Wendy is with us. Okay, we'll catch Wendy when she arrives. Thank you. Next slide, please. Sarah Bartleman, the costs program manager at Oregon Health Authority, will address some issues that have risen around conflict of interest. Thank you.
Thanks, Rhonda. Hi, everybody. I'm Sarah Bartleman. I manage several programs at OHA, including the Healthcare Market Oversight Program, and wanted to just give everyone an update and be really clear on the record what has been happening around conflict of interest. So, as some of you may be aware, on March 26th, OHA received a letter from an individual expressing concerns that 2 community review board members may have a conflict of interest under Oregon law. The claim was also shared with local media. The Community Review Board members mentioned in this letter reached out to the Oregon Government Ethics Commission, also known as OGEC, to obtain an opinion as to whether there is a potential or actual conflict of interest under Oregon government ethics law. OGEC provided their opinion on Friday, April 4th. In summary, Community Review Board member Jerry Delness may have a potential conflict of interest if the CRB recommendation on the proposed transaction could have a financial impact on his employer. Joanna Motz does not have either a potential or actual conflict of interest. Under Oregon law, when a potential conflict of interest exists, public officials, like Community Review Board members, must properly disclose this information by making a public announcement describing the nature of the potential conflict before taking action like voting. Community Review Board members must also provide a written notice outlining this potential conflict. OHA required all potential members of this Community Review Board to provide conflict of interest disclosure forms as part of the Community Review Board application process. This was above and beyond the requirements in state law and something OHA did to ensure due diligence and neutrality in reviewing the proposed transaction. So, what does all of that mean for us today? As you know, the Community Review Board did not take any official action at the meeting last week. And today, the Community Review Board will vote on its recommendation to OHA. In response to the concerns raised, Joanna, while having no actual or potential conflict of interest, has decided to resign from the Community Review Board. Jerry Delness has voluntarily resigned from the Community Review Board based on his potential, not actual conflict of interest. A claim was also made about our facilitator, Rhonda, having a potential conflict of interest in this transaction. Rhonda did not work for OHSU or Legacy. She did provide consultation for the Gun Violence Prevention Research Center at the OHSU-PSU School of Public Health last year and received a one-time honorarium award. Rhonda's engagement with OHSU-PSU School of Public Health had concluded before OHA began working with her. Rhonda disclosed this information to OHA as part of the contracting process, and OHA consulted with the Oregon Government Ethics Commission about a potential conflict of interest. OHA contracted with Rhonda's firm, Insight for Action LLC, to facilitate the Community Review Board meetings, not to make a decision or recommendation, nor to take any action regarding proposed transactions. Rhonda has neither a potential nor an actual conflict of interest. The Oregon legislature created the Healthcare Market Oversight Program to address the potential negative impacts of healthcare consolidation. One of the primary goals of this program is to shine a light on the impacts of healthcare consolidation where transparency did not exist before. Community engagement and public input is critical to the healthcare market oversight process to help OHA understand potential impacts of a proposed transaction on the cost of healthcare, quality, access to services, and health equity. These elements, transparency, community feedback, and accountability, are at the heart of what we work toward every day. OHA has been receiving up to 100 public comments a day for this proposed transaction and is striving to post all public comments as soon as possible after processing. OHA took the claims presented seriously, and all parties took immediate actions to address them. OHA went above and beyond state requirements for public officials to understand any potential ties that Community Review Board members may have to the transaction and to ensure a fair and balanced discussion. In the end, the claims presented did not meet the bar for an actual conflict of interest. We thank all of the Community Review Board members for their service and look forward to receiving the Community Review Board recommendation later this month. Please contact me if you have any questions about this, and Lauren is going to share my contact information in the chat so you can reach out directly. Thank you so much.
Thank you, Sarah, for sharing concerns that have been raised and how resolved for conflicts of interest. Let's move on to the next slide, please. Oh, if we can just keep on the recap of past discussions for a moment, please. Thank you. For the last 3 meetings, the Community Review Board members have engaged in robust and thoughtful discussions about the potential opportunities and concerns about the proposed transaction, including how well the proposed transaction may meet the 5 criteria of the Healthcare Market Oversight Recommendation Framework and ideas for addressing concerns and strengthening opportunities. The statements made by the Community Review Board around general concerns, opportunities, and the 5 criteria have been captured in past meeting slides, and they are now also included in an appendix document that has been posted on OHA's website. Thank you, Melissa or Lauren, for uploading the URL link to the appendix that summarizes all of the comments in the chat. We are not going to revisit the statements around general opportunities and concerns or statements about the 5 criteria because we've done that twice now in the meetings. In last week's meeting, we brainstormed potential ideas for addressing concerns raised and strengthening opportunities. I'm now going to briefly review several slides that captures those ideas because we have not reviewed those statements in writing.
Rhonda,
mhm.
before you jump in, Wendy joined us if you want to have
Oh,
her
thank
do.
you so much. I appreciate that, Lauren. Hello, Wendy. If you have a moment, would you be willing just to turn on your camera and just say hello? As a warm-up exercise, we just invited each of the Community Review Board members to share their name, remind you where you're from, and if you have a spring favorite flower, to share that.
Wendy Martin, Portland, Oregon. And I think all of the flowers right now are beautiful.
All right. Thank you, Wendy. Appreciate it. Okay, so what I'm going to do now is I'm actually going to share the ideas that were generated from the Community Review Board around concerns and opportunities raised. I'm just going to go through the slides and read those ideas. And then at the end, I will pause and ask if there's any observations or comments that the Community Review Board members want to share about what was documented with your ideas. Okay, thank you. Next slide, please. So from the last meeting, I generated ideas to consider to address concerns around metrics. And some ideas were to fully develop metrics in shorter time period of time, have an enforceable plan for what happens when they aren't met. In terms of the concern around access to care and in-network status concerns, some ideas were unsure if we can't force OHSU to stay in network with insurers without unfairly shifting negotiation power, could try to force insurers to be in network with institutions. Next slide, please. The concern around union and non-union workforce not treated the same, as well as other workforce issues. These were the ideas of how to address. Provide same guarantees to unrepresented employees as represented employees. Proportional reduction in represented versus unrepresented employees. Limits on executive competition or exit packages bonuses. Ask OHSU to post workforce plan, wage and benefit parity agreement. Ask that they create management integration agreements, extend job protections, job placement services. Create a formal labor management integration committee. Extend job protections beyond the 6 to 12 months currently promised. Could also include job placement services for those who lose their jobs. Next slide, please. The concern around community input on establishment of the foundation. Idea, the foundation could follow recommendations provided through public comment, like those provided by Community First Campaign. Foundation board should have community members rather than the current board. Another concern, Legacy's plans during the public hearing mentioned steps they could have already taken. Idea was ask why Legacy hasn't already asked for higher Medicaid reimbursement and started leasing properties that they could, started leasing or selling properties that they could for revenue. A third concern was commercial prices may increase more due to transaction impact premium costs. The committee was unsure that this current concern can be addressed. Next slide, please. The concern about impact for Medicaid patients, an idea was that the percentage of Medicaid patients can't decrease, mandate that. Are not sure how it could be impacted. There was some conversations around that. Another concern was the changing financial conditions for both entities. There was really not a lot of discussion around that concern. Next slide, please. The concern that worried nothing will get better, transaction could make cost, quality, access worse. Some ideas of potential ways to address. OHSU has to make a public semi-annual report about these cost, quality, access questions, require annual reporting with independent third party, report on $1 billion capital that they're promising, and those associated metrics, grant making, and other milestones, and that they are unable to reduce critical services in critical areas. Another concern was around the Oregon National Primate Center, some ideas to address. Some were unsure how to address, if need to address, or create a community review committee to review the primate center and address community concerns, create alternate plan for inspections if USDA cannot perform due to capacity issues. Next slide, please. The next couple of slides are about opportunities that were identified and ways that those opportunities could be strengthened. An opportunity that I was identified is both entities are committed and have good intent for the proposed transaction. A potential way to support is a public performance evaluation for executives, especially if aren't meeting stated goals of transaction. Another opportunity identified was Health Equity Foundation. Having that $600 million could have a large impact. A potential way to support is look at the Community First campaign suggestion on financial planning, make sure money is used in appropriate ways. Next slide, please. Another opportunity was that many nonprofits and professional organizations are in support. Ideas to strengthen that opportunity, work with federally qualified health centers and community health centers to expand access. Also asking commitments from OHSU to other nonprofits to enhance efforts of community outreach access. Another opportunity was freeing up OHSU capacity to provide specialty tertiary care, decrease wait times to access tertiary care. There wasn't a lot of discussion or ideas raised around that opportunity. Next slide, please. This is the last slide. The opportunity identified was entities have stated their desire to increase access to primary care. Ideas, potentials, ways to support is create a public report of metrics with addition of primary care metrics. Make sure entities are always accepting new primary care patients. Hold community events, free clinics that help connect community members to available primary care provider. Another opportunity was potentially prevent, reduce access, increase costs, and again, not a lot of discussion or ideas around that one. So that was a very quick windshield tour of the concerns and opportunities that the Community Review Board has raised and the brainstorming of potential ways to address those concerns or strengthen opportunities. I'm going to pause now and invite Community Review Board members to share if there is any critical observations, reflections, or any modifications that maybe perhaps the slides didn't fully capture. So please, and if so, please just raise your hand and I'll call on you in order. Yes, Leslie, please.
This is just an observation that there were a lot of public comments that had been put in since the last meeting last Monday. And I appreciate OHA putting them all together in the PDF for us to be able to review and weigh in. So just an observation. And I hope that the other Community Review Board members, I'm sure you have, had a chance to look at those.
Thank you, Leslie, for alerting us of the many comments that have come in since last week. Any other comments, reactions, modifications to what I just shared around ideas on how to address or strengthen? Yes, Howard?
Yeah, I have a number of concerns about the way this is all summarized in here, in terms of the way at least I've gone back through that again myself, and I'm not sure when the best time to bring those up. I think at some point, if we decide to move forward with recommending with conditions, that would seem like a time to maybe discuss that in more detail, as opposed to doing it right now.
Sure. I think that's a proposal that we absolutely can move on if it turns out that there are some community review members who want to vote for approve with conditions, because as you'll see in the voting process, that would be part of the process. And I invite you, Howard, if there is one or two things right now that you think is really important to lift up before we go in that direction, I would invite you to share a couple of the most critical observations, reactions.
Well, I think one is around the community, the foundation. The way it's worded, my own bias on my own feeling about this was that the foundation should actually follow the recommendations that Community First campaign has listed, including potentially having to start from the beginning again to meet the recommendations of the Community First campaign.
Okay.
One, and the second one is around, I guess I would just say, is around the metrics again, and the timeline for the metrics being completed and ready to use, and also some of the specific metrics that are shown in the proposal that's submitted for the transaction. Again, there's no metric that I can see around patient experience of care. And specifically as a neonatologist who's well aware of Vermont-Oxford network, I think that particular metric that they've listed is not a very good choice. And there are better ones that could be used to evaluate neonatal care and possibly also the perinatal measurements. Yeah, I'll stop there.
Okay, thank you, Howard. Really appreciate, that feedback. And again, if the process leads to where a member wants to vote with conditions, I think that's like what you said is a place to dive in a little bit more specifically at what some of those conditions may be. Are there any other comments, observations around what I just shared before we move on? Okay. Let's move on to the next slide, please. Okay. Now it's time for the Community Review Board to make a recommendation about the proposed transaction to the Oregon Health Authority. I can imagine that some of you, Community Review Board members, may have a variety of feelings right now. Some you may feel excited, maybe a little nervous, maybe even a little stressed. That's normal. I want to underscore the commitment and effort that I've observed of each and every one of you that have given to this Community Review Board. You've participated in now 8 meetings. You've read and distilled a lot of information from documents and public comments, and even maybe a lot just this past week, as Leslie reminded us. You've listened to testimony of the entities and public verbal comments, and you've really shared what you've learned about the transaction with each other through these committee meetings. And I've observed you listening deeply and commenting and reacting to each other's perspectives in a appropriate way. So now it's time to lean into your experiences as a community member. to make recommendation about the proposed transaction, because that's what this community review board is, right? Is for you as community members to share what you think is in the best interest for the residents of the state of Oregon. Next slide, please. Of course, we have looked at these group agreements every time we've met. As we recall, we agreed to these during our first meeting together. And I'm just calling out 4 of these that I think are really important during the conversation that we're going to have. And the first is just to continue listening actively, because as you'll see in the voting process, you're going to have an opportunity to vote perhaps a couple of times, and you're going to share your rationale for that recommendation. And people's votes may be different, of course. And so I'm just inviting each and every one of you to just listen actively to your community members as they're explaining their rationale. Number 4, assume positive intent. Because this is more of a critical moment where some of us may be feeling very passionate, or some of you may be feeling very passionate about what the vote should be. Just keep on assuming positive intent if someone's, explaining something that doesn't resonate with you. And if there is any point where it feels like there was an ouch, feel free to say that, and we can pause and just address that. The 5th, which I've highlighted over and over again, which we're doing a great job, but it's just continue to welcome disagreement, your varied and opposing ideas without being disagreeable towards each other. And you've been doing an excellent job of that. And then the 8th one, of course, is just a reminder, and which I'm going to go over in just a second, that we've agreed to do consensus decision-making, but if we're unable to reach it, we'll use majority vote. Okay, next slide, please. Again, you've seen this slide many times, but since this is the actual time that we're using it, I want to go over it again. I believe, as we all know, the Community Review Board is charged with recommending one of the following outcomes to Oregon Health Authority: to approve with conditions, or disapprove the proposed transaction. As we already know, the board has agreed to use consensus decision-making, and I'll just remind us what that means more in a moment. And if a consensus-based recommendation cannot be achieved by the end of our process for voting, we'll go with majority vote. I want to remind us that agreement on recommendation requires that a majority of the Community Review Board members are present, a quorum. Right now, our Community Review Board has 6 members because 2 have resigned. And so we have all 6 of you here, so we have a quorum. Next slide, please. Again, consensus means that we get to agreement that everyone can support. What that means, you either champion it, you like it, you can at least live with it, or you won't oppose it. That's what we mean by a consensus-based decision. As you'll see from the process that I'm going to share, we'll have full and complete discussion. And if we get to a point where there's just one person perhaps who has a minority from the majority of the vote, we'll just check in with the minority and just see if there's any alternatives, modifications to get the minority into the majority. Okay, so I just want to do last quick check if there's any discussions of what we mean by consensus or majority vote, because then I will go into a little bit more details about the process. Okay, next slide, please. This is just giving a little bit more description of what we mean by the recommendation options. Approval. If you vote for approval, that means the transaction can proceed as proposed. A reminder, the transaction is subject to the following follow-up reviews by Oregon Health Authority. Oregon Health Authority would do a 1-year review, a 2nd-year review, and a 5-year review of what was agreed upon for the proposed transaction. The second recommendation option is approval with conditions. This means the transaction can proceed, but must meet certain conditions. The transaction is subject to compliance verification reviews, including the same time of reviews: 1-year, 2-year, and 5-year review. The third option is to disapprove, and this means the transaction cannot proceed as proposed. and there would be no follow-up reviews. Any questions about what each of these options mean? Yes, Leslie?
Can you clarify on the middle category about approval with conditions? Does the CRB have to have those conditions nailed and solidified before we send it to OHA? Or just can you share a little bit more about that timeline and our responsibility as community review board members?
Thank you, Leslie. That is a great question. So if the community review board recommends to approve with conditions, the expectation is the community review board would have a list of conditions to share with Oregon Health Authority. So let's just say ideally today, if it turns out there was a consensus-based or a majority to approve with conditions, today we will have a list of conditions. Of course, some of that brainstorming, a place to find ideas would be the brainstorming, that was done last week. Howard already referred to that. I want to remind the community review board members that the responsibility is to come up with conditions. These are statements, general approaches. These do not need to be refined, wordsmithed, nor written in any legal format. I want to remind you, as a community review board, you are making this recommendation to Oregon Health Authority, correct? Oregon Health Authority would look at those conditions. Oregon Health Authority would determine which of those conditions are actionable, are legal, or, they will be, that entity, Oregon Health Authority, is the entity that would actually, if Oregon Health Authority chose to go to approve with conditions, that's where they would really refine those conditions to make sure that they are appropriate. So I don't want you all getting hung up. Oh, is that legal or is that actionable, or what words should we use? We're not going to go there. And I'll even remind folks, if we end up doing that, to not get too in the weeds. We want the big ideas. Leslie, does that answer your question?
Yes, thank you.
Okay, I just wanted to pause. If my Oregon Health Authority colleagues, if there was anything that I said that you feel that needed to be fine-tuned.
Nope, you got it, Rhonda. Thanks.
Okay, thank you. All right, Joe, please.
Thank you. I believe we were told in an earlier meeting that OHA does have some enforcement powers around these reviews. I guess I'm not sure if one of those enforcement powers is to revoke an approval or if that's even practical. I assume it's not really even practical, but is a condition that we could impose a plan to reverse the transaction at specific periods if it meets certain kind of completely off the rails conditions, if you get what I'm saying.
Yes. I'm going to move to the next slide. Teresa, I'm going to come back to you, but just Joe, since you started this, can we move to the next slide, please? Joe, I'm not sure if this, I don't think this totally gets at your question, but just reminding, that we have spoken in the past about enforcement ability. And this is just reminding us that Oregon Health Authority is legally required to review compliance with approval conditions at minimum. Failure to comply with Oregon Health Authority request may result in Oregon Health Authority seeking all remedies available under law, including but not limited to civil penalties. And if there's any other observations or comments that people want to make, feel free.
I can jump in on that one. Hi, Joe. I think that all remedies available under law does include a menu of options up to and including unwinding the transaction.
Thank you, Sarah. Appreciate that. Joe, has your question been answered?
Yes, it has. Thank you very much.
Teresa, please.
Just
I'm
to be-
sorry, could you go back, Lauren or Melissa, could you go back to the previous slide? Thank you. Yes, please, Teresa.
So if I understand correctly, it is possible that if we recommend approval with conditions, we might choose a condition that is not feasible or not even legal potentially. And then OHA could be required to remove that from the list of conditions, and then the transaction would proceed without that condition.
So Teresa, I'm going to respond, and then if any of my OHA or Sarah, would you? I saw you just came off camera, so.
Yeah, I'm jumping in for OHA today. So I think broadly, yes, what you're saying is that if the Community Review Board recommended a condition to OHA for a variety of reasons, that might not be a final condition that OHA imposes.
Great. Looks like Teresa, your question was answered. Okay, thank you, Sarah. Appreciate it. All right. Any other questions before we move on? Yes, Wendy.
So for Sarah specifically, is it possible that OHA will add conditions that maybe aren't coming out of the committee as well?
That is possible, yes.
Thank you.
Okay. Not seeing any other hands, so I'm going to move us on to the next slide. We already went over this. Next slide, please. So again, we have seen this slide several times, but I'm going to go over it again and just make sure questions have been answered. In order for the Community Review Board to recommend approval or approval with conditions, the transaction does not need to meet all of the criteria on this slide. This is a reminder, all the criteria listed on this slide are the ones that is drafted in the statute. The transaction, in order to approve or approve with conditions, the transaction needs to meet A. So the transaction needs to demonstrate there is no substantial likelihood that the transaction would otherwise be hazardous or prejudicial to consumers or the public. The reason why that one is bolded is that's because we're asking the Community Review Board to provide information, recommendation that this has been met. The ones that are bolded, that are bulleted, but they're not bolded, those are the criteria that Oregon Health Authority needs to do, but they're not asking you because they're very technical in nature. So they're not asking the Community Review Board. But to repeat, to vote for approval or approval with conditions, the Community Review Board should have high belief that there is no substantial likelihood that the transaction would otherwise be hazardous or prejudicial to consumers or the public. And on the right-hand side of this slide, need to meet B or C. So for B, the transaction would benefit the public good and communities. There's 3 bullets listed here. One is around costs. One is around access to services in medically underserved areas. And one is around health equity. In order to meet B, at least one of these bullets would need to be demonstrated. Or just C, the transaction will improve health outcomes for residents of the state. So again, must meet A, it needs to either meet B, one of those bullets, or C. Okay, I'm gonna pause because I know we've had some discussion. It's not the most elegant understanding of how the statute was written. So I just want to pause and just see if there's any final questions about what we are asking you to consider when you're making your recommendation. And as a reminder, of course, you have access to the slides. We will put this slide up when I'm asking for rationale. This will be a support that we will use as we go through when we're giving rationale for our recommendations. All right, let's move on to the next slide, please. This is the voting process, and let me just go over it here. We may have 3 rounds. We may have 1 round. It's really going to depend upon what the votes are for the recommendation. In the first round, I'm just going to ask each community review board member to give their vote. If you approve, approve with conditions, or disapprove without rationale. If everybody gave the same vote, we have consensus. Okay? And then I would open it up and invite each committee member to share their rationale for that vote. And we'll have that criteria up there so we can document your rationale. And if it turns out everybody in that first round said approved with conditions, we will discuss rationale first, and then we'll talk about conditions. Lauren on the Oregon Health Authority staff, she will be, kind of typing in the background. Conditions that are brought up after we've stopped, we'll put that up, that Word document, and we'll get agreement. Again, we're not wordsmithing, we're not diving into whether this is feasible or legal, we're not getting into the details, but we would get to a general place where we could kind of say, yeah, these are the conditions we think are most important. Okay, so that's how round 1 could look like. Now, in round 1, if we don't have consensus, we are going to move to round 2. And in round 2, I'm going to invite each person to then give a rationale for their vote. Okay. And I'm going to start by asking folks, the majority, whatever the majority was, ask those to go first, then second, and then the minority. And be able to explain the rationale. And then if someone did vote for approval with conditions, we'll do that same process. We'll brainstorm conditions. Lauren will be drafting it. We'll put it up there. Okay. Then we'll take another vote and see where we are. If it turns out that second round that some people change their vote, which typically happens in these things, then that's a consensus based and we'll be done. If it turns out on round 2 vote, we still do not have consensus, then on the third round, I'm going to invite the minority, whatever the minority vote may be at this point in time, ask folks to share any other pieces of information, and if there's anything that we could do to shift, modify for the minority to feel comfortable with more of the majority vote. And then we'll take, and if there's some community review board members that just have some specific questions, can ask them, and then we'll take the final vote. And that will be the final vote. So it'll be consensus, or it'll be majority vote, or if it turns out, because we have 6 members, if it's 3 and 3, it's 3 and 3. It's a split vote. Okay, and then we'll be done. What questions do you have about the process? Yes, Howard?
So my understanding that if we all agree on the recommendation, recommend with conditions, or not recommend, that the conditions we don't have to agree on. We can
If you vote with agree with conditions, I want to get a good enough. Like, okay, this is a pretty good. I'm not going to force us to wordsmith to get where everything is perfect, but if there is a majority or if there is a consensus based of approve with condition, I want us to have a list that we feel pretty good about.
Okay, so we don't have to have consensus on the list. We just have to have a list
That's good enough.
we would send forward. Okay.
Yeah, it's good enough. Okay, I'm going to move us. Where are we at? Okay, so we ready to go? Next slide, please. Okay, so this is round 1, and I'm going to call out each community review board member in reverse alphabetical order. And I would ask each person just to state approve, approve with conditions, or disapprove. Hold your rationale for right now. I will tally the votes, and then we'll go from there. So Wendy, requesting you to go first, please.
The hot seat. approve with conditions.
Okay, great. Teresa, please.
Disapprove.
Leslie,
Disapprove.
okay. Latoria,
Rhonda, Latoya had to jump real quick. We'll circle back.
okay. Will you let me know, Lauren, when she comes back on?
Mm-hmm.
Okay.
Yes.
Joe,
Disapprove.
Howard,
Approve with conditions.
okay. So we have 5 votes right now. Hopefully Latoria will go, but we still have a quorum, right? So we can still move forward. So we have 2 that voted to approve with conditions, and we had 3 that voted to disapprove. Did I capture that right? Okay. Okay, let's go next slide, please. We're going to hold off on a break because we're doing okay. It's not top of the hour, so we'll come back to a break. So let's go to voting for round 2. So what I'm going to do now is I'm going to invite each community review board member to explain their rationale by referencing the criteria, and we'll put the criteria slide up. As members share their rationale, I might even invite members to say, could you say a little bit more about that? Could you expand a little bit more, just so we could fully understand the rationale and we can learn from each other. And so how I'm going to do this is I'm going to start by starting with the majority recommendation right now, which is disapprove. And so I will call out disapprove and then ask members to share their rationale. And then I will go to approve with conditions because that was the second on that, and ask for the rationale. And again, as a reminder, that since we have 2 that approve with conditions, once those 2 folks have shared their rationale, we will start brainstorming conditions and seeing what those conditions may look like for round 2. Okay. All right. So for disapprove, there was 3 of you that disapproved. So I'm encourage you to raise your hand and share your rationale for disapproval. Melissa, would you please put the next slide, which is the criteria, up so people just have that in front of them? That might help them shape their rationale. Thank you. So I'm looking for volunteers to start sharing their disapproval, and that was Joe, Leslie, or Teresa. To raise your hand, I'll call you in order. Thank you, Teresa.
I voted disapprove because of the A criteria, be hazardous or prejudicial to consumers or the public. The elements that we really cannot set conditions on and we don't have control over are, the main one is pricing. There's also insurance contracts. And not being able to set any guardrails on that means that we can't control access because prices will inevitably increase. All of the literature that shows that that's what happens, there's abundant scientific evidence for this, makes me think that a 10 hospital system in a market the size of Portland will shut out certain people. And that will not only by increasing prices, but increasing prices reduces access and therefore affects equity.
All right, Teresa, are you good? Thank you very much for kicking us off. Leslie, please.
I voted to disapprove based on looking at the 4 domains and responsibilities as a community review board member. And while, so I'm basing my vote on how the proposal is written and the information that I've had access to, as well as the public comments. And so for me, it does, there's a lot of hope, and I think there's a lot of good intent. And there's some things that could be as it's currently written, but it lacks substantial detail around that criteria A of, the benefits for the public. So it's that, will it otherwise be hazardous or prejudicial to consumers or the public? I feel like that's not met, that I can't say 100% that the proposal has that. And the things that concern me the most are similar to what Teresa out.
Good, Leslie? Thank you. Joe, please.
So, I largely agree with the concerns of both Leslie and Teresa with regard to market consolidation and the impact on costs. So that's criteria A. I think that both systems have a tremendous amount of good intent for this transaction, and they have very talented people. I just think that meeting that as a single combined entity would be more difficult than going forward with two separate entities engaging in good competition in improving outcomes, improving access, and the combination into a single entity just presents increased risk that that one entity will not be able to live up to the approval criteria. And I think both B and C have the potential for not being met as well.
Thank you, Joe. You done?
Yeah, thank you.
Okay, so thank you to Teresa, Leslie, and Joe for sharing their rationale for their disapproved vote. And I appreciate how you were reflecting the criteria in that rationale. And what I heard all three of you say was that you didn't believe that this transaction would meet criteria A. There is no substantial likelihood that the transaction would otherwise be hazardous or prejudicial to consumers or the public. That was one of the main themes I heard. Is that fair? Yeah, thanks, Teresa. Yeah, Joe, Leslie, can you? Yep, okay, great. All right, I believe I want to give a heads up on the process. And I believe that we will now move to approval with conditions. There were two people, Wendy and Howard. So I would invite Wendy and Howard to raise your hand, and I will call on you to share your rationale. All right, thanks, Wendy.
Yeah, I actually agree with the concerns that have been shared. I do, however, also have a concern that access to services will decrease within the legacy system, which is the more geographically distributed system, and will impact those medically underserved areas even more, especially with some services that already are very limited in those areas. I believe OHSU's resources, if limitations could be put on that, ensured that the type and level of service in those sites didn't decrease or even increased by a certain degree, would be meaningful to health outcomes for the residents of the state. And so conditions would include things like not reducing the type or level of services or level of care in any of the current sites, as well as ensuring capacity for new patients to enter the system. I'm not sure exactly what those criteria look like or how they are sort of governed over time, but I think it can be done. And I really do believe that not doing this, unless Legacy has another plan, we will see a reduction of services.
Okay, Wendy, are you done? Thank you. Okay, Howard, I believe. You're up.
I'm glad I went last. I appreciate everybody's comments and rationale for their votes, and I mean, I was leaning pretty heavily towards no, not approving, because I didn't think that the transaction met any of the criteria, either A or any of the B or criteria or C. And then I went back through the conditions, through the concerns and the opportunities, and kind of was able to come up with a list of conditions, pretty extensive ones, that I would feel like need to be met before I could to keep my vote as recommend with conditions. So what I think I'll do is just change my vote to not recommend. Which is where I was leaning. I was thinking that others in the group here would also be with conditions, but I appreciate everybody's comments, and I agree with them. I do agree with Wendy about the potential if this doesn't go through related to legacy, but I think there are other ways that the needs of the community that legacy supports can be met. And I think they will be met, because I think as in the 2008 financial crisis, legacy is too big to fail. The state will step in, or there'll be someone else will step forward to partner with them to keep that from happening. I didn't realize that we actually have a constitutionally mandated Oregon ballot measure 111 was passed in 2022, which mandates the state to make available appropriate, affordable care for everybody in Oregon, similar to several other states. This came across my mind reading about what would happen if Medicaid expansion is decreased, and there are certain states that have in their constitution that they would have to come up with the funds. And I think Oregon's constitution really also does that. So I think legacy can be supported in other ways. So will change my vote to long-windedly say, do not recommend.
Okay, are you good, Howard? Okay, thank you for that thoughtful sharing of your rationale. So it's just about top of the hour. So we are going to take a 5-minute break in a moment, but I just want to go back to the process that I first shared, and I want to stick to that process. And so that process was that if in round 1, there was not consensus, we went to round 2, and that's what we're doing. Oh, Melissa, could you go back to the slide that just shows the process? Yes, go back. Yes, there, thank you. So we did round 2. Everybody explained their rationale. And we had one member who's now, shifting a vote, but we still had at round 1, 2 people that voted for approval with conditions. We maybe are down to 1, but I did say that if anyone votes for approval with conditions, and we still have 1 person who has that vote, we will brainstorm potential conditions. So I want to honor that process that I laid out in the beginning. So what we're going to do, we're going to take a 5-minute break, and we will come back, and we are going to brainstorm conditions. Howard already mentioned he had some that he had already, previously brainstormed. Wendy, you already shared, some conditions. So we are going to work to get the most critical conditions laid out. Okay. And then After that, I'm not going to ask for consensus on that. I'm not going to ask for agreement, but just list what we are seeing as community review board members as the critical conditions, if there was a vote to approve with conditions, okay? And then I'm going to go back and ask, again, following the process that I laid back, go back and do a second vote and to see if there's any shifts there, okay? So look forward to seeing folks back at 1:05 and ready to brainstorm conditions and then go for the formal second round of vote. See you then. All right, welcome back. Thank you for everybody coming back after a short break. I just want to make sure that our community review board members are here and we have a quorum. Okay, I see you, Wendy. Thank you. Joe, I see you. Thank you. Teresa, I see you. Leslie, I see you. Howard, I see you. I do want to just ask if Latoria is with us. And if so, Latoria, could you please raise your hand or put your camera on? Okay, I'm not seeing you. I just want to remind folks we do have 5 community review board members. And so we need a quorum. Well, we have a total of 6 community review board members now. We have 5 with us, so that is a quorum. So I believe we can move forward. So as a reminder, we did. Could you please share the slide for the process of the voting, which is slide 25. So right before break, we went through round 1 voting. We had 3 committees members who said disapprove, 2 that said approve with conditions. In round 2, we explained our rationale using the criteria. And we said if anyone votes with approval with conditions, we'll brainstorm them. During that round 2, one of the community members who said approval with conditions changed the vote to disapprove. But to honor the process, I am going to invite Wendy to start us off and with sharing what some potential conditions may be. We may have a minority report here, given where we are landing with the votes thus far. So I want to make sure that we have some time to process what might be conditions under that minority recommendation, if that turns out to be the case. So Melissa, will you go back and share slide 29? So we have the criteria in front of us as we're brainstorming criteria. And Wendy, would you be willing to share what you would see as some conditions to be considered?
Yeah, Rhonda, I'd actually like to request sort of a flip on this. I would like to hear from the folks who are on the other side of this vote, if there are any conditions that would be helpful.
Okay, Wendy, so
and if not, I'd also like to hear that. I mean, I understand I'm the holdout here. I'm slowing down everybody's process and day. This is a big deal though, and I really want to make sure that I understand that from the other folks who have put their time and energy and experiences into this as well.
So first of all, Wendy, thank you for that process suggestion, and I really appreciate it, and we'll definitely move forward on that. And you are not slowing down the process. You are not the holdout. This is exactly what a community review board does, is we listen, we educate, we share. And that's where we are in this process right now. And this is a healthy conversation and dialogue. So you are not slowing down the process. This is exactly what we should be doing. All right, so I'm just going to echo Wendy's request for others to share what might be some conditions. Joe, thanks for kicking us off on that.
Sure. I did prepare some conditions because it was a difficult vote, obviously, for all of us. So mine's not real long, so I thought I'd just do that quickly.
Thank you.
Binding commitments for improving access to underserved communities. Binding commitments for community benefit and charity care. Equal protection for all employees, starting with the current agreement with the unions, and maybe even, better than that, but not dropping it down to the low end. I had an annual reporting or reporting requirement, but I think OHA already does that, so we don't need that. I thought a good suggestion might be to have the governor and the Oregon Health Authority examine the issues and make recommendations regarding the disposition of the Primate Research Center. And then allowing full access and privileging or maintaining full access and privileging for independent physicians. And that's my impulse is not to create a whole bunch of conditions, because that makes the leadership, it kind of binds them in many ways and makes things more difficult in some ways. But I think this was the list that I had of conditions that would allow me to kind of go approve with conditions, but I think I'm still on disapprove.
Okay, thanks, Joe, for kicking us off. And just reminding, Lauren is, kind of drafting these behind the screen. And so we are capturing those. Leslie, please. And you can either just kind of echo what you heard Joe say, or if there's additional ones, please.
Thanks, Rhonda. And Wendy, I think this is great. Approving with conditions is not off the table for me. I'm just not sure we can get there, like Joe was saying. Is that the purpose, and what do we, have authority to do, or OHA have authority to do? I think for me, brainstorming, the conditions that I would definitely want to highlight are the same ones that Joe, but I think for me, one of the ones that wasn't mentioned is the issue of the primate center. It's become a central point of the public comment, and I don't want to disregard that, but I'm not sure that that's the responsibility of our work. And so, and I know the governor's had some recent, discussion about it. So that would be, I think, from hearing from the public that that's a big issue, I would consider that as one of our brainstorming conditions to include. I also think there is a condition around the antitrust review and involving the Department of Justice. And again, that may be happening in parallel to our work as a community review board, but want to certainly call that out. And then really hone in on the foundation, as Joe mentioned, the issues around that and the board structure and the things that are proposing. Again, that's not what we've been looking at, but that's a big piece if they go together. And then lastly, really digging into those metrics and implementation timelines. I felt like that was really lacking. And if we could get to a point where that could be conditional with more substance, that might be something to consider.
All right, thank you, Leslie. I hear you concurred a lot with Joe's and added a couple of extras there. Teresa, please.
I'd like to thank Joe and Leslie, because I agree with everything that they both said as potential conditions. I also, in a perfect world, if I could recommend anything, I would like to see more of a partnership or collaborative agreement between the two entities instead of a full acquisition by OHSU of Legacy. I don't know if we can put that as a condition or if that's a completely different application. My hunch is that it probably is, which is why I voted to disapprove, because I thought, well, the door remains open for OHSU to modify their application, and they can always resubmit. So I don't really have specific criteria, I guess, to add to what Leslie and Joe said.
Thank you, Teresa. Anybody else want to share? I know, Howard, you had mentioned that you had some conditions. Are there any other ones, or you don't want to voice support for what you've heard?
I think I've heard pretty much what I would be worried about it. Around the primate center, because I have an extensive patient safety background and knowledge, I was thinking more around a condition to have a safety expert come in and do a independent consultation at the primate center and make recommendations for safety. particularly what's called a culture of safety in healthcare and other organizations. I don't have a sense that they have a good culture of safety, and a consultation, I think, and an action plan based on that consultation could be something that I think could keep the primate center open and functioning.
Okay.
I had specific comments similar to what others maybe more specific around the metrics. In terms of the timeline, I don't think they need more than 6 months to get the metrics in place, and I think they need an action plan for the metrics, along with just having the measurement. They need action plans for making improvement that need to be fairly specific. What I said earlier about patient experience being part of the metrics. And I noticed looking back at them yesterday, that a number of the metrics are focused just on CCO patients in terms of the scope of what's being measured. And I think those metrics should be expanded to all their patients, not just CCO patients. I've already mentioned what I think about the foundation. Really, I think needs a redo based on the community first campaign. Several public comments from them. I think those are good comments and very specific, and I think those would need to be in place for the foundation to move forward in a way that lets it meet the goals that it's talking about meeting.
Okay, I believe that everyone's had an opportunity. Wendy, or would you be willing to share how well you concur? If there's other things you would like to see?
Yeah, I agree with all of the conditions, and in reality, there are probably a few more that haven't been mentioned but are on our prior slides that would need to be there. I do hear, loud and clear, the concerns are still there, and there's a concern that we just really aren't going to be able to put enough conditions out there with enough teeth. I mean, unwinding this, even if it were possible in the written documents, in reality, both systems would suffer even greater losses. Undoing that's expensive. So I know there's a process here, but I do think that the reality is my vote will shift to disapprove, with the hope that the two systems will continue to look for other options to staff those 500 beds, to get students and early career professionals out to the rural sites, and that the state is really going to stand behind Legacy and help solve some of their bigger challenges. There may also be an opportunity for OHSU to acquire or partner in a different way with specific facilities or specific sectors of Legacy. But ultimately, this is too big with too many risks for us to put enough regulators on. So thank you all for sharing.
Anything else, Wendy? Okay, well, thank you all. We did capture, I was writing notes, and I know Lauren was writing notes in terms of conditions as well. So thank you for sharing those. Can we put on slide 28, please? Yeah, so we, of course, have gone through this process. We explained our rationale. Someone did recommend approval, so we brainstormed those. And so now it's time to revote. Leslie, please.
I'm curious, I know we're going through a process, but is Latoria going to have a chance to weigh in just so we can hear her perspective?
I'm kind of pausing. I don't know how to respond to that. Latoria is double checked. She's not on the call now.
Okay.
Hey,
Sarah?
Rhonda, you want me to respond to that?
Please.
Yeah. So I think we are assuming that Latoria will not be here for this round of voting or for this meeting for the remaining 40 minutes. I think so we'll proceed without her and the quorum of 5. Latoria is still a community review board member and will have the opportunity to review the draft recommendations report and participate in discussion at the next meeting.
Thank you.
And Leslie, thank you for asking that question. I know we've had a quick shift, right, in the community that we've worked with over these past 7 meetings. And so I appreciate everybody's flexibility as we move forward with a smaller group than we started with. So thank you for asking that. And thank you, Sarah, for reminding us that Latoria will have the opportunity to look at the draft recommendation, that OHA will look at the next steps in a moment, and that she will have the opportunity to be at the June 16th meeting where she could provide feedback then. So thank you. Okay, so what I would like to do now is I'm going to call, I'm trying to switch it with alphabetical or reverse alphabetical order, but what I'd like to do now is start in alphabetical order. And Howard, so that means I'm going to start with you, and I'm just going to call each person to state their vote now. So Howard?
My vote is not to approve.
Okay, disapprove. Thank you. Joe?
Disapprove.
Okay. Tori, Leslie?
Disapprove.
Teresa?
Disapprove.
And Wendy?
Disapprove.
Okay, so we have a quorum. We have a quorum, and we have a consensus-based recommendation to disprove the proposed transaction for all of the rationale that we shared respective to the criteria. We did brainstorm conditions. So Oregon Health Authority, in terms of when they write the recommendation, they'll determine whether or how that's included. But that has been captured for the record here. I want to give a heartfelt thank you and acknowledgement of the 5 of you. We've already shared the amount of effort and time that you have all invested in this voluntary process, all with the aim to come up with the best solution for residents of Oregon. I can imagine this was a challenging decision-making process for all of you. I really appreciate how well you listened to each other, shared your concerns, and we're just figuring out from your perspective as a community member, what do you see as the best course of action? So a big thank you. If we can move to slide 31. So let's just clarify next steps. So based on this recommendation, Oregon Health Authority will draft a recommendation report more similar to a memo. I've looked at a past one, and it's concise on the shorter side, really summarizing the Community Review Board's discussions and final recommendations and rationale for the recommendation. Oregon Health Authority will post online and send links to the Community Review Board members by April 9th. So you have an opportunity. That's a pretty quick turnaround, but you will have an opportunity to look at it. And during the April 16th meeting, the Community Review Board will review the draft recommendation report, identify any changes that are needed, and approve the recommendation report with any potential edits that were requested. Next slide, please. So just couple of comments about reviewing the draft community review recommendation report. When Oregon Health Authority emails the members, with the draft report. The ask for the community review board members is to review the draft report and email at this email any edits or comment, if applicable, by 12 noon on April 15th. So that's really have a sense of what your feedback would be. A recording of today's meeting will be posted online within 48 hours in case anyone wants to listen to the conversation again. All recordings of community review board meetings are currently posted online. Want to pause there and just see if there's any questions from the community review board members about next steps in the process for the recommendation report. Yes, Howard.
Just want to clarify that the HCMO make a different recommendation than the one we've just made?
Yes,
Or
Sarah. Yeah, thank you, Howard. And again, since Sarah's been coming offline, I'm wondering if she'd be willing to.
Yes, I can take that one. So I think you might remember a slide that we've shared in a previous CRB meeting that has sort of the arrows with the inputs into the healthcare market oversight program decision. And so the community review board recommendation today and the final recommendation next week is one of the inputs. There are several others, including the public comment, the analysis that our team is doing, our outside advisors that are consulting and providing analysis, and the healthcare market oversight program will be putting all of that together. So the short answer is yes, OHA's final decision could be different than the community review board recommendation, but we are considering all of those inputs.
Howard, that answered your question? Any other questions about process, timeline? All right, next slide, please. So the next meeting is on April 16th. Howard, I just want to check, did you have another question or is that an old hand? Thank you. So April 16th from 2 to 3, we'll review edits to the draft recommendation, vote to finalize the recommendation as written in the memo with any requested edits. And then final recommendation will be provided to the Healthcare Market Oversight Program and will inform the decision about the OHSU-Legacy proposed transaction. Just again, Howard, you foreshadowed this, that this is one of several sources of information that the Healthcare Market Oversight Program will use when it issues its final decision. Next slide, please. Again, this is all the information of where you can find everything about the transaction and who to email if you have questions and where the website is located. Next slide. Yeah, just a big thank you. Thank you for everyone's participation. And we look forward to your comments and feedback on the recommendation memo in advance of the next meeting. And we'll look forward to that final meeting together. I wish everyone a few moments of joy in the rest of their day today after this pretty heavy thinking meeting. Bye.
thank you.